But no, the Republican plan we've waited weeks and months to see doesn't do any of those things. In fact, it's not even about health care at all, even though it's on the health care bill, this plan that they've outlined. The first and only plan Senate Republicans bothered to draft is an instructional manual on how to bring the Senate to a screeching halt. We knew that was happening anyway, but they had the audacity to put it in writing.
Senator Judd Gregg, author of the memo, responded slowly.
It is ironic, is it not, that the majority leader would come to the floor and complain about an innocuous statement which outlines the rules that members of the Senate have, a statement which I suspect he actually would pass out to his members for information were they in the minority, maybe even in the majority. Isn't there an ironic inconsistency to his outrage on the fact that we have suggested that people should know the rules here, while he has basically tried to go around the rules?
Who do you think you're talking to? Third graders? Innocuous, just outlining the rules, some snippets. A point of order, with or without cause, unlimited number of amendments, germane or non-germane. Delay is created by the 2 roll call votes. Time-consuming motions can also be used to extend consideration. Joining us now from the Senate debate is Oregon Democrat Ron Wyden. Senator, thanks for your time tonight.
Thank you, Keith.
Delayed. Let's talk first about the specifics of this latest version of the trigger now under consideration for the public option. What can you tell us about it?
We've got to make sure, Keith, that the public option has real teeth in it. We've got to make sure that it's within reach of all Americans, because the bottom line is the consumer ought to have the chance to give the insurance industry an ultimatum. That ultimatum ought to be treat me right or I'm taking my business elsewhere. We're willing to look at a variety of different approaches to doing this, but ultimately the public option has got to be about having choices for the consumer to hold the insurance industry accountable.
How do you get that and Olympia Snow too?
My sense is that we're going to have some pretty passionate discussions over the next few days, but ultimately this is about holding the insurance companies accountable. If at the end of the day a single mom who, for example, isn't eligible for subsidies, doesn't have choices, that's not going to do it. I wanted to see McCarran-Ferguson be changed, so we lift this ridiculous rule that doesn't apply the antitrust provisions to the insurance industry. But we've got to have real choice, it's got to have real teeth, and it's got to be within reach of the public. Right now, the Congressional Budget Office says that only about 3 million people would even be able to take the public option.
That's for 3 days and then stop. Did something change, and do you think the Republicans are going to plan to sit in now, or perhaps will they lie down in front of your car?
I think the American people are watching that we want to have a real debate on this. The American people aren't interested in robocalls, and they aren't interested in campaigning. That's for the political consultants. The United States senators are supposed to have debates. We're supposed to make sure that all sides have a chance to air their views, and then we vote.
Senator Ron Wyden of Oregon, as always, great. Thanks for stepping out for a moment and joining us.
Thank you, Keith.
Let's assess the political state of play now with MSNBC political analyst Howard.
Hi, Keith.
Let's pick up where Senator Wyden led off. The Republicans stalling. Anything to add about this?
Yeah, I think a couple things. First of all, the role of John McCain is fascinating.
Yes. He just mentioned, he didn't say it, but he mentioned it. The robocalls are a reference to John McCain in Arizona, correct?
Yeah, exactly. And you know, McCain, some people thought, me naively being one of them, back after the election, that McCain might have been an ally and good soldier with Barack Obama in a spirit of bipartisanship. What a fantasy that was. That's all over with. McCain is the point of the lance here. The Republican strategy, at least this week, in addition to the delay, is to try to gin up as many votes on Medicare, any permutation and combination of Medicare, Medicare Advantage, Medicare, any spending in Medicare, to force Democrats into the position, especially ones who are up for re-election in swing states, of having to say, yes, we need to make some cuts in some spending related to Medicare. Then come the 30-second ads and the robocalls, and that's what John McCain's up to. That's really a big part of the whole Republican strategy right now.
The public option.
Public option insurance company won't help a single poor person get insurance. It won't force a single insurance company to give insurance to people who are sick. And it won't even contain costs. I think it was originally put in there as a kind of accommodation to people who really want a single-payer, government-controlled insurance company.
Senator Lieberman said it very well.
And so, less than half an hour after the lovin' began, it all ended in tears.
When Senator Lieberman talks about single payer, I think he's putting his finger on the pulse of it. That's what people are confusing the public option with. It isn't a single payer. I would invite everyone to read the fine print, and with Susan and Joe to reread the fine print.
To be continued.
As promised now, Ohio Senator Sherrod Brown, proud co-sponsor of the Coburn Amendment requiring members of Congress to join the public option. Good evening, Senator.
David, how are you?
Good. Have I got the story and the motives right on your dance with Senator Coburn? Can you fill it in for me?
Yeah, you often find out about amendments going on the Senate floor, and if my staff or I like one of the amendments, we'll call an office and just say, Republican or Democrat, I'd like to co-sponsor. We do that as a matter of course. It happens across party lines all the time, hundreds of times a day. We did that with Senator Coburn. 9 times we said we wanted to co-sponsor. Usually it takes once and they say yes. I've always accepted that. So has everybody I know in the Senate. 9 times we asked to co-sponsor, and their office either just said we'll get back to you or ignored our calls and our emails because it was all a sham. I mean, they clearly don't like the public option. They were making fun of it. Their whole game is to delay and deceive and to play political games. And when they offer an amendment saying sign up for the public option, tell members of Congress they have to join the public option, I think I should. I think we all should, but they don't even like it themselves. And so it's just a little partisan games they're playing. And this is too serious for them to play those kind of games.
What is in this public option alternative we expect to see next week?
Yeah, well, I don't see a public option alternative. We've compromised 4 times already on this, and we've compromised enough. It's time for the 4 Democrats, Senator Lieberman, Senator Lincoln, Senator Landrieu, and Senator Nelson. It's time for them to compromise and come over with the other 56 Democrats who strongly support the public option. I mean, we've got to get moving on this bill. We've got to stick together. And in the end, I don't think any of these 4 want to be the one to bring this bill down on a procedural vote. They don't want to be on the wrong side of history ultimately, and that says to me that when it really comes time, they're not going to vote against this most important bill in their whole political careers on a procedural vote.
Well, let's be clear then. Would you join Republicans to block an up or down vote on this bill if, in fact, it waters down the public option any further?
Yeah, I don't draw lines in the sand publicly. I'm going to continue to work to get this public option in. I predicted as early as July when Senator Whitehouse and I wrote this public option language in the HELP bill back literally in July. I predicted then it would stay in the bill. It will get to the president's desk. I still think it will, and I think it will be a good, strong public option that keeps prices down, that makes the insurance companies honest, and that's the whole point of it.
Imagine you're Harry Reid. How do you get either A, you get 4 conservative votes from the Democratic caucus, or B, pass the bill with fewer than 60 senators supporting it?
Well, you get those 40, those 60 votes, all 4 of them, all 60 of us, by continuing to talk, continuing to be in these meetings, as many of us are that care so passionately about this, and then ultimately you bring people together and say, we need this. You're leaders in the party. 4 of these people we're talking about, 3 of them are committee chairs. All of them are on one of the 2 most prestigious committees in the Senate. They're getting all kinds of push from home to vote for this. The public wants the public option overwhelmingly. Democratic activists want the public option. It clearly, according to all polls, it clearly works for the country. It works for most people. It will keep prices down, and it'll keep the insurance companies honest, as I said. And we just know the insurance companies always try to game the system unless we have ways of enforcing the new consumer protection rules. No more pre-existing condition, no more making women pay more than men for their health insurance premiums. Those days are behind us. We need the public option to make sure those rules are enforced.
Congressional Quarterly reported today that Senator Ben Nelson said he needs time before he introduces an amendment blocking even more coverage for women who have abortions because groups including the U.S. Conference of Catholic Bishops need more time to review the legislation. Amendment itself aside, what are your thoughts on outsourcing legislation to religious leaders?
I'm sorry, I couldn't hear the question, the last part of it.
Well, the question is about Ben Nelson. He said he needs time before he introduces an amendment to consult with the U.S. Conference of Catholic Bishops. What's your view of outsourcing legislation?
I'm fine with Senator Nelson bringing his amendment in with the Stupak language. Let's bring it for an up or down vote on any of these issues. The Republicans were blocking a lot of votes this week earlier. They wouldn't, literally, under Senate rules, they could stop us from doing it. But let's vote on the Stupak-Nelson language on abortion. We'll defeat it. Let's vote on taking the public option out. Give everybody a chance to bring these forward, vote on them, then vote for cloture. Don't kill on a procedural vote. We'll pass a bill that's progressive and good with a strong public option if we get a chance to do that. And I'm confident Senator Nelson and Senator Lieberman and Senators Landrieu and Lincoln will let us do that in the end.